SEG training amblyopia. Let's talk a little bit about amblyopia, or otherwise what patients may call lazy eye. Causes of amblyopia SEG training amblyopia. Take two. Let's talk a little bit about amblyopia, or what patients may call lazy eye. There are a few causes of amblyopia. One is a refractive error, which is measuring the prescription. There can be a high amount of prescription in both eyes, but more commonly there's a higher amount of prescription in one eye than the other, and that difference creates a problem at the brain. The brain does not pay attention to the eye with a higher prescription. There's a blurry image on the retina, and the brain starts ignoring that eye. Strabismus, or when the eyes don't aim the same place in space, typically the turned eye will be ignored by the brain, causing amblyopia. And there can be deprivation, which means that there's something blocking the light getting out all the way through the eye to the retina. And cataracts at an early age, or when born, is the most common. That is the least common that we see in our clinic. What is amblyopia? Well, historically, we always just paid attention to the eye chart, and most patients just think of it as a blurry eye chart in one eye or both. But it actually is a developmental delay of one or both eyes. And what that means is the brain is not developing good vision, good clarity, and really all of the skills that eye needs to see, as well as work with the other eye. It does result in poor clarity, so we do see it on the eye chart, distance and near. It results in visual crowding, which just means that then when there's more on the eye chart or more what the patient's looking at, it gets blurry. And it can have poor development in all areas of vision. So what we actually see in a patient's life is poor vision in one or both eyes, suppression of binocular vision, which means they're not using both eyes at the same time. One eye is being suppressed or ignored, and lack of 3D or depth perception. Amblyopia is also the most common loss of vision in people under the age of 45. So for young, otherwise healthy people, most common cause of vision loss. The cool thing is there is a lot we can do about it. And one of the things that not everybody knows is the amblyopic eye has problems and has a developmental delay. But because of the amblyopia, the other eye, the fellow eye, can also have poor eye focusing and eye movements for reading, and not work together, of course, as a team. There can also just be some general discomfort of the unequal images, and sometimes patients actually say they see two, but they kind of ignore one that's more blurry. This can impact down the road. It can impact sports and hobbies that patients decide to partake in, particularly things with ball sports and eye tracking. Certain jobs, for example, pilots need to have a high level of 3D to be able to perform in their job and actually be trained in that job. And then we also see patients that just don't do certain things. They don't enjoy reading, their coordination or balance is off, and they may not pursue certain sports. The research actually shows that patients actually pursue less further education if they have amblyopia than others who do not. Treatment of amblyopia has really changed in the last couple of years. There's a couple options. Annual eye exams are really important for kids and teens to be able to prevent some types of amblyopia. If we can catch it early, we can actually prevent it and treat it early, and then that takes care of it for the rest of that patient's life. Prescription glasses or contact lenses are typically needed to get correct the blurriness on the retina and get the brain starting to pay attention to both eyes. And then there typically is what we call occlusion, which is either an eye patch or an eye drop that blurs the non-amblyopic eye. We are using that less and less as there are other options. And then there is optometric vision therapy. And that's where we're working on kind of that whole developmental delay of the eye, not just the clarity in the eye chart. And we're really working to build 3D. So Currently at Specialty Eye Care Group, we are at the cutting edge of this treatment. There is a lot of current research and evidence showing that we can actually improve amblyopia faster and keep that good vision for longer without much patching. So patching used to be the only option. Now we have other options which are particularly oriented in treating 3D. So getting the patient seeing 3D, teaching their brains to see 3D, and getting the brain using both eyes so it's not ignoring the eye anymore. Parents and patients need to know that we can treat this at any age. Yes, adults can be treated, and the treatments are beyond just patching. So in our clinic, how we do the 3D treatment, some patients can be treated at home. We give them particular red, blue, or red, green games to do at home. They are prescribed to do them every day, and we see them on a monthly basis. And we are looking for particular improvement. Other patients that need more intensive or more individualized treatment, or if they have a strabismus, then we need to do in-office treatment, which is in our vision therapy clinic, and the doctor prescribes that. So we do treat the clarity, the eye chart, we build depth perception 3D, and we get rid of the suppression or the brain ignoring the eye, which is really important for them keeping that good vision. This is an example of a couple different games that are out there for the iPad or iPhone or any kind of phone device. And you can see that it's red, blue. So one eye sees the red, one eye sees the blue, and both eyes will see anything that's black. And they wear special 3D glasses to do this game, and it's helping their brain learn 3D. This shows a little bit of how we can use different colored filters. You can see that on the left, if the patient's wearing that lens, they cannot see through the green, but they can see through the red. So we can use this in our therapy clinic to help modify what patients see and teach them to see 3D. This is more of an example of in-office treatment using a touch screen that has red-blue. So one eye is seeing all of it, the other eye is seeing some of it, and we're teaching a number of things at once. This is a patient seeing eye teaming and 3D, and what we're seeing here is red and green circles. He's wearing red and green glasses and seeing depth perception and learning how to work his eyes as a team. And this is a patient wearing special 3D glasses with a 3D TV and vision therapy treatment teaching her to see 3D. So you can see that vision therapy and even the home program can be a lot more fun than simply wearing a patch. Our goals of treatment are definitely better clarity on the eye chart, that the brain no longer ignores the eye, and that we are building depth perception or 3D. We want this to translate to their actual life, and that can mean, and what we've seen from patients, they are actually catching and hitting a ball a lot better. They've actually come in saying they can see 3D, which is exciting. Even an 8-year-old has said that. They can change lanes and park easier and drive because they have that 3D vision. They're enjoying reading, or they may be passing a visual test to be able to become a police officer. These are all things we've enriched lives in our clinic for some of our patients.